Is it possible to have pelvic floor dysfunction even though you have testing such as blood tests or urine tests that are negative and imaging such as MRIs, CAT scans, or ultrasound, and they're all negative? Your doctor looks at the results and say, everything looks normal, yet you're having symptoms. You're having pelvic floor dysfunction. Is it possible that you go through all these tests and they're negative and you still have pelvic floor dysfunction? The answer is yes. My name is Nadia Mills, and I'm a pelvic floor and lymphedema physical therapist. Please stick around and watch this video to find out how it's possible to have completely negative tests and still have pelvic floor dysfunction. Hello, beautiful people. My name is Nadia Mills, and I'm a physical therapist. I specialize in pelvic floor dysfunctions, and today I am freshly back from a family fitness wellness day where I had a table and I had quite a number of people come by to talk to me about physical therapy. So usually when I have my table, I have regular physical therapy items, and then I have my little section for pelvic floor therapy. And it's a nice way for the community to see or at least become familiar with the word pelvic floor therapy. And some people are actually brave enough to ask me questions about pelvic floor therapy. Far too often I hear this scenario. I've been having symptom X or Y, pain, pressure, incontinence, or something like that. And I've been to the doctor and I've had tests and I've had imaging and nothing shows up. And when I talk to my provider, they tell me there's nothing wrong, but clearly there's something wrong. Have you had this experience and have you had those kind of answers? The truth is, a lot of providers are not aware of pelvic floor dysfunctions or the symptoms that they present. And yes, you can have a battery of tests, blood tests, other tests, and imaging, and nothing shows up. So at this event, there were quite a few brave people, and there was this very brave lady who came and she said to me, I've been experiencing some symptoms. I've been experiencing some pelvic pain. And when I go to the doctor and I've had testing done, I've had imaging done, and they tell me nothing is wrong, but I am having this pain. And I sympathize with her because unfortunately, a lot of pelvic floor dysfunction is misdiagnosed or ignored because the standard tests that are completed show nothing. Or even with a typical exam, nothing is present. Unfortunately, a lot of times, providers are not familiar with pelvic floor dysfunctions. And so if they do not find anything in their traditional methods, they are not really aware of what to look for to classify it as pelvic floor dysfunction. So here are a couple of examples of where tests can come out negative, but you're having symptoms. Example number one, if you're having a burning sensation with urination, they'll do a urine analysis to see if you have a UTI. And if this is negative, the provider might say your test is negative, so there's nothing wrong. But when it comes to pelvic floor dysfunction, there can be several issues that can cause burning sensation with urination. It could be tissue inflammation, it could be tissue tightness, it could be bladder irritation, it could be nerve irritation. None of these will show up on a test or on an image. So that's just one example. Example number two, a heaviness sensation, which is usually associated with a prolapse, meaning one of your organs is descending or falling, and so there's a heaviness in your pelvic or groin area. What can happen with this, unfortunately, is if you're doing imaging such as an MRI or an ultrasound, you're in a position where you're laying down. A lot of times, prolapses, if they're not very severe, they will only show up when you're in a position where gravity is pushing down on your body, such as in a standing or sitting position. So when you're laying down to take the test, your organs may look completely fine and not have any problems. The other thing that may happen is the prolapse might only be present when you're straining or pushing, that is putting pressure through your abdomen. When you're laying down for a test, you're relaxed, you're not pushing or straining, and so therefore your organs might just look like they're in the perfect position with absolutely nothing wrong. So that again is another situation where imaging can be misleading as to what is happening with the pelvic floor organs. Another example is pain with penetration, such as penetration for a gynecological exam or penetration for intercourse. You might do a transvaginal ultrasound, and while you're doing a transvaginal, you may not have any pain. Also, they may not see anything in the tissue that will indicate that there's an injury. However, when you are having a gynecological exam or having intercourse, it might be severely painful. Again, the size of the ultrasound one is much different to the size of an organ that might be penetrating, or the size of a speculum, which will have to sort of stretch and open the vaginal canal to observe the uterus. So there are a lot of times that these standard tests don't account for what the issue might be with the pelvic floor. And so they may come up negative, but that by no means but that in no way means that there's not something happening with the pelvic floor muscles or the organs in that area. So yes, it is possible to have pelvic floor dysfunctions and have tests show up normal. So for example, it is possible to have pain in your pelvic region, whether it be in the abdominal part, whether it be around the bones or the muscles, or just in there or down there somewhere. And you will have tests and it will not show any injury, it will not show any fractures, it will not show any infection, it will not show any damage to the muscles. However, with the pelvic floor, if there is tightness, if there is dysfunction, if there is nerve pressure on the nerve, you will have symptoms. And so a lot of times typical approaches do not assess this and they are not able to detect what the problem is that you're having. Fortunately for you, you now know about pelvic floor therapy, and we address several conditions that are typically overlooked in traditional settings, even if you go to your gynecologist. So even the gynecologist, they have their exams, but what we do for pelvic floor therapy is a little bit more in-depth and a little more specific to the muscles and the organs in the pelvic region. So if you are having pain, discomfort, pressure, heaviness, it could be incontinence, it could be constipation, I will actually list several conditions that pelvic floor therapy treats, and it's a long list. And I will start doing videos to start explaining all of these different conditions. But if you look at the list and one of these is something you've been diagnosed with, or if you've Googled it and it sounds like that, these are things that pelvic floor therapy treats. The other thing I encountered in my interaction today is another lady who says, "Oh, I Google everything." So she came up and she told me, "Yes, I'm familiar with pelvic floor therapy. I'm familiar with Kegels because I Google everything." Please be cautious with the information that you get from the internet without consulting a professional. Not everybody needs Kegels. And as a matter of fact, for some conditions, Kegels are actually not recommended. And so it's really important to at least have one conversation with a pelvic floor therapist if you are having some difficulties or challenges with potential pelvic floor dysfunction. It is not a one-size-fits-all treatment approach. And so it is very important that you hear specifically what you need and also specifically what your condition is. It is not always about Kegels. As a matter of fact, for a lot of my clients, I tell them to stop doing Kegels. So it's really important that if you have the opportunity to speak with a pelvic floor therapist, they can educate you. The number one thing that we do is education, because there's so little that we really know about our own bodies and specifically about our pelvic region and our pelvic floor. So thanks again for everybody who sees me out on these fairs and who comes up and talks to me. Also remember, I am providing free consultations. I would love to share the information and knowledge with you so you can understand your body better and know what you need in order to make it work properly. So thank you guys for watching my videos. Thank you guys for subscribing and sharing. So please continue, click on the subscribe button, click on the notification so that when another video comes out, you'll be aware. And thanks for your questions. Really appreciate you. Until next time, love yourself, take care of yourself, love others, and always bring kindness to the world. Bye-bye.